It's Jordan again from Manchester. I was once a lip disaster, but now I'm known in England as the Lip King. I need a crown. It's been a few years now since I've seen Dr. Nassif and Dr. Dubrow. Filler's been leaking out of my lip.
Oh,
now
really?
that's scary.
You know that this can cause a horrible infection. You're asking for a horrible complication.
After their advice, it did scare me a bit. And then I was like, oh, maybe I need to calm down a bit and not inject so much. But I'm obsessed with fillers. So I decided to go and train to become an esthetician. And that's what I do now, and I love it. I have a gorgeous clinic in Manchester. It's just so me. It's got gorgeous furniture. I've got a massive throne I can sit on and be all regal. It's just like my playground. I still pinch myself now, and like when I'm doing people's lips, I'm like, oh my God, my life could not get any more perfect. My first visit with the doctors was not only about my horrendous lips, it was obviously about my bent up nose. From when I was about 9, I always said to my mom, I hate my nose, it's big, it's crooked, it's hooky, I want to get a nose job. So I wanted a Kim K nose, and they were like, no, you'll have breathing problems.
Okay, come on. Okay, now, can you breathe like that? No, don't get panic attacks. But how do you like that?
No, my lips were really dry. Well, I didn't listen. 4 nose jobs later, and I've now got breathing problems. I can assure you 100% I will never stop having plastic surgery. When I'm 85, I'll be the hottest looking, plastic looking guy in the bingo hall. In the past 3 years, I've had, obviously, my 4 nose jobs. I've had upper eyelid surgery to get rid of the excess skin. I've had a lip lift. I've had a chin implant, neck liposuction, and then I also had liposuction on my stomach. It was 100% the worst surgery like I've ever done. It was so painful. And so I left it, and I was literally like, I'm still fat. Like, you didn't take anything out. Like, all that pain and bruising for nothing. I did not have liposuction to be left with like a lumpy belly. If I wanted to do that, I would have stayed home and just ate fish and chips. I'm back to see the doctors to show off my new luscious lips, but then also hopefully they can help me with my nose, make my nose a tiny bit smaller and help my breathing a bit more. I want more liposuction to fix the lumpy lipo. I then want all the fat transferred to my butt, so I've got a big old booty, just like Kim Kardashian. This place is gorgeous.
Oh, well, thank you.
I'm here for my lipo treatment. I'm hoping that from the lipo massage that I'm gonna have, it's gonna even my stomach out a bit, get rid of some of the lumps, and just create a more softer, smoother appearance.
This is your suit. What I'm asking you to go ahead and please put it on.
Oh my God.
It's a full body suit, yes.
Do you not have bigger sizes? Oh my God.
You're gonna get into this.
I need to like oil it up or something. Without baby oil, Crisco, or some other lubricant, I'm never gonna get my body into that bodysuit. Oh my God, this bodysuit, which is more like a body condom, feels so itchy, it feels tight, it feels uncomfortable. This bodysuit will be the death of me. Sometimes the things we do with beauty are just absolutely ridiculous, but they are 100% all worth it. So I had liposuction, and I've been left with like lumps and everything.
It will help with smoothing those areas that you're not happy with.
Okay, how quick do you see results with this?
In a 3rd to 4th session, actually, they see complete result.
I'm very impatient. I like results quick. I'm a bit more fake.
Yeah.
You couldn't tell. I love looking fake. I love it. I love blurring the lines between men, women, masculinity, femininity. I just love it.
Hope to see you again.
Oh,
wishing you
thanks,
really
Maria.
good luck. Please let me know if you need any help or anything I can assist you. Call me in.
Thanks, Maria.
So remember years ago, we had a patient come in from over the pond who had a lot of lip fillers.
The guy who wants to look like Kim Kardashian?
Yeah.
That guy?
Jordan.
Whoa.
His upper lip is smaller.
Whoa.
Okay, so he had his nostrils, his nose is completely over-rotated.
So he's had some tummy surgery. Okay.
Can you please send in Jordan?
Guess who?
Look
Hi, guys.
How you doing, buddy?
My two favourite doctors. So the last time I saw the doctors, my nose and my lips entered the room before I did. So I'm just hoping this time that the doctors will operate on me. Fingers crossed.
Your face looks completely different.
Completely different.
I mean, completely.
How many surgical procedures have you had?
Oh my God. Liposuction on my stomach, my hips, and my back. I've had a chin implant, I had neck liposuction, I've had my nose done 4 times, I've had a lip lift, I had my upper eyelids done. I went a bit mad. Plastic surgery is 100% like sex. You can't have it once, you have to have it over and over and over. And if the surgeon's good, then you keep having it with the same guy. I did listen to your advice about the lips though, they're small.
By the way, the lips look smaller.
I have my own clinic in Manchester now.
Really?
I've got my license to do fillers.
You're allowed to stick needles in people and inject
Are
whatever
you doing
you
your
want.
own?
Yeah.
It sounds like Jordan got a license to fill. Hopefully, that license comes with some skill. We left you last time with the advice to reduce, not augment your lips, because we were worried your lips would fall off and die.
Yeah.
What was the first surgical procedure you had after that?
I had my nose done. So he said to me, like, how do you want your nose? And I said, well, I want it small, I want it quite Iranian, I want it lifted, I love that.
Wait a minute, you want to quite what?
Iranian. Iranian noses are just so cute. And they're in fashion right now. Everyone's got an Iranian nose. They're just lifted and like really pretty.
Okay,
And he did say to me, if you do go this small, like, you
won't be
might
able to
have
breathe.
breathing problems. And I was like, yeah, that's fine. I can breathe through my mouth.
Did you get breathing problems?
Well, yeah, like I'm a bit nasally, like. So then I had a tiny bit at the side that I wanted chiseling some more. So I've had 4 now.
Wow.
When we said stop filling your lips, that didn't mean start ruining your nose. What are you actually trying to do now?
So I just want you to have a look just to see if we can do anything about my breathing, you know, maybe to make it better. And we could maybe lift this a bit more and maybe chisel.
By the way, we also saw some pictures of your abdomen. What did you do to your abdomen?
Oh, so I had liposuction on my stomach and it's like gone quite like bumpety.
Right.
So you're here to see us for that too?
Yeah, I'm the lip king, not the lumpy lipo king. More liposuction on it and then put in my bum. I've got Kim's nose now, I need like a bigger bum. I think Paul's into it. He keeps staring at me across the table. It's this new nose, is it? It's doing it for you.
You know,
Would you try and take me home?
nah, I'm not. All right, well, let's go to the exam room and we'll take a
let's
peek
do
at
it.
you.
Hey.
Let's take a good look at those.
They're cute, aren't they? Do you guys remember the sample we took last time?
No, let's look
No,
at
oh my gosh, you have
Oh
it?
my God, my nose is enormous on it, look.
Wow. Wow, look at those lips. Jordan's really changed a lot, and Paul's got a lot older too. But I still look incredible. All right.
Look, I'm still fat.
Okay, yeah. Your abdomen has very actual little fat in it. It's mainly loose skin. If you do, Jordan, any more liposuction, it's gonna be looser. Liposuction can result in kind of a vicious cycle of more and more liposuction that needs a major surgical procedure to fix. Now that you've had it done once, you have a lot of scarring. That fat that has all the scarring in it doesn't transfer well to the buttock. It won't survive.
I appreciate their warnings, like I know that their advice is the right advice, but you only live once. I want a big butt for summer. Bring on the booty.
Okay, head back. You can, all right, we're gonna look. You can breathe now, right?
Yeah.
So your septum is deviated to the left a little bit.
Yeah.
So surgery would involve taking a piece of rib and putting him here to open up your airway to make your nose fatter.
Bigger?
Yeah.
You're not gonna
Wider?
Yeah.
No. Oh, no.
No, that's the only way to open up your nose.
I would never let anyone take any of my body parts to make my nose bigger, wider. My nose is never going to be made bigger now, only smaller.
So I have an idea for you. These are called nasal cones.
Okay.
Insert these in your nose.
Like,
Okay, now breathe.
Oh, I can breathe so good.
So this is your surgery. When you need to breathe heavier, for whatever reason, use that. Sleeping, working with your patients, just use that.
The nasal codes are really cute. but I probably won't wear them. We need one more selfie.
Okay.
It does feel amazing to have like two of the best surgeons in the world giving me advice, but I just love getting surgery done. It's just fun.